But anyway, each of the innovations I'm sure is going to be great.
Thank you. Thank you. Thank you.
Thank you so much, ma'am. So, Dr. Apurvan, shall we move ahead?
So, moving on from that wonderful talk, we have the special privilege of hosting Dr. Wong Chee Wai. Is he here?
Hi,
Yes, ma'am.
I'm here. Yes.
Hi. Dr. Wong Chee Wai is an ophthalmologist at the Glen Eagles Hospital, Singapore. He was a big part of SNEC prior to this. He's set up the myopia clinic there, and he's also done his post-graduation from there. He has an immense number of publications in the field of myopia and ocular drug delivery, and he's got several awards for his research work. He's got travel grants, and he has served as the deputy director of SNEC's undergraduate education, and he was the program director of the Duke NUS Medical School's ophthalmology program. He's a committee member, obviously, of the Singapore Young Ophthalmologists Society, and he is a reviewer in the big journals in ophthalmology like IOVS and Ophthalmology. He is the recipient of the Singh Health Healthcare Heroes Award, the Young Eye Ambassador Award, and the Singh Health Quality Service Award. We are really honored to have you here, Wong Chee, and I really look forward to hearing your talk on ocular drug delivery. Is nanotechnology the way forward in ophthalmology? Thanks for being here. All yours.
Thank you. Thank you so much for your kind invitation and also introduction. I'm very impressed with Dr. Prasanna's ophthalmic metaverse, and hopefully I can share something that is equally exciting. I'm going to share my slides now. So today I'll be talking about nanomedicine, which I believe will be the next frontier for ophthalmology. And this is based on the work that we did at the Singapore Eye Research Institute on liposomal drug delivery. So first of all, what is nanomedicine? If you look at the diagram here, you see that on the nanoscale, this is essentially a subcellular scale. So nanomedicine is the application of nanotechnology, which includes biomaterials at the subcellular level. And the advantage of this is that we are able to then influence cellular activities and processes directly. So nanomedicine has found application across a wide spectrum of modalities in medicine, which includes imaging, diagnostics, regenerative medicine, as well as nanotherapeutics. So I believe that nanomedicine could be the next step in the evolution for ocular therapeutics and diagnostics. And today I will talk on how it can revolutionize ocular drug delivery. So nanomedicine's one of the first utility for nanomedicine is used as a drug delivery platform. It can be broadly classified as lipid-based nanocarriers, which includes liposomes, polymeric nanocarriers, which includes hydrogels that most of us would be familiar with, and also dendrimers and micelles, as well as non-polymeric nanocarriers, gold nanoparticles being one of the most commonly used nanoparticles. So today I'm focusing on liposomes. What are liposomes? They are essentially naturally occurring membranes in the human body, which means they are perfectly biocompatible as well as biodegradable. And advantages of using liposomes is that you can encapsulate drugs either in the aqueous core or in the lipophilic bilayer. So a wide variety of drugs can be included and encapsulated by the liposome. And by encapsulating the drug compound, you can slow down degradation. And liposomes are selectively targeted by macrophages. So essentially, it selectively targets inflamed sites, and at the same time, it avoids undesired drug effects at non-inflamed sites. Liposomes are very versatile drug delivery system. So there are many ways you can alter the physical chemical properties of liposomes, which includes its charge, its size. Typically around, the size of it is typically around the 50 to 100 nanometers. And you can also modify the cell surface receptors to give you a variety of functions. For example, you can make them You can add polyethylene glycol onto the cell surface to make them stealth liposomes. These avoid detection by the circulating macrophages, which allows them to circulate in the systemic circulation for a longer time. You can also add cell surface receptors to make them target specific cells in immune liposomes. You can alter charges to protect the payload. You can also create stimuli-responsive liposomes that release the payload on stimuli such as heat and light. So what we did with liposomes at the Singapore Eye Research Institute was that we're trying to solve the HO problems of eye drops. So eye drops have been in use for ophthalmology purposes since 150 years ago, but yet there's not been a lot of innovation, and we are still faced with some of the limitations of eye drops, which include low bioavailability, difficulty in instilling, and also reliance on patient compliance, which often, as you know, will be difficult. This was one of the first studies that we did. It was a preclinical study where we looked at the use of subconjunctival liposomal steroid to treat experimental uveitis. So the aim of the study was to demonstrate efficacy of subconjunctival liposomal steroid. We had two types, liposomal triamcinolone acetonide and liposomal prednisolone phosphate. And this was the study design. We pre-immunized the rabbits with TB antigen, and then on day 0 induced uveitis. On day 3, we injected the rabbits based on their treatment groups. So there was a control group and there was an eye drop group. We had 2 separate subconjunctival liposomal steroid groups, a single injection of that on day 3, as well as a subconjunctival free prednisolone phosphate group. On day 8, we simulated a relapse by injecting antigen into the anterior chamber. So looking at the performance of the liposomal steroids against eye drops, we saw that the initial suppression of inflammation was much better than eye drops. And also, it was able to prevent a rebound inflammation after a repeat simulation of inflammation on day 9. And compared to daily eye drops, a single subconjunctival dose of liposomal steroid was able to achieve the same sustained anti-inflammatory effect. When we looked at the liposomal steroids compared with the free steroid, we saw that the initial suppression of inflammation was similar between the two groups, but the free steroid was not able to attenuate the rebound inflammation on day 9 compared to the liposomal steroids. And free steroid was also not able to sustain the anti-inflammatory effect at 2 weeks compared to the liposomal steroids. Histology confirmed the clinical findings with more inflammatory cells seen in the eye drop groups as well as the free steroid groups compared to the liposomal steroid groups. And also confocal microscopy showed that the macrophages as well as the liposomes were co-localized. So this provides evidence of the selective targeting of macrophages to the inflamed sites in the ciliary body, as well as the iris, and specifically inside the macrophages. There were no side effects which included raised intraocular pressure or cataract formation from the use of these subconjunctival liposomal steroids. So we can see from these preclinical studies the promise that is liposomal steroids can be promising agents for anti-inflammatory treatment in cases of anterior segment inflammation, and that liposomes also demonstrated selective targeting to inflamed sites with little side effects. So we went on to perform a clinical trial. This was a phase 1/2 clinical trial using liposomal steroids. And we wanted to look at cataract surgery because cataract surgery, post-cataract surgery inflammation is the most common cause of anterior segment inflammation. And as we mentioned, there's lots of limitations with the use of steroid eye drops, particularly in certain groups of patients like the elderly, children, the non-compliant, and patients with concomitant medical conditions that may make it more difficult to use eye drops after surgery. So in these patients, these were patients that were scheduled to go for cataract surgery. At the end of cataract surgery, we gave a single subconjunctival dose of prednisolone phosphate and then monitored them for ocular inflammatory scores as well as safety outcomes. This was a small pilot study of 5 patients, but we found that all the patients tolerated the procedure injection very well. None of them had any side effects, including raised intraocular pressure or cystoid macular edema up to 3 months after the surgery. And all of the patients had complete resolution of inflammation. Laser flare photometry also showed that there was a complete resolution of inflammation in all patients. So in conclusion, I think nanomedicine is particularly relevant for ophthalmology because the eye itself is a very special organ with multiple barriers for drug penetration. So nanomedicine, with its selective targeting, with its reduced degradation of the payload, can certainly be of a huge benefit to ocular drug delivery. So in particular, liposomes are very effective because they are targeted towards macrophages, and also they encapsulate the payload, which then effectively enhances their therapeutic efficacy without the off-target side effects. So there are many future applications of nanomedicine